Italy may have started to turn the tide on coronavirus as the data showed the death toll has fallen for the second consecutive day to 602 victims, offering a glimmer of hope the national lockdown is working. The country remains the world's worst affected by the coronavirus, with 6,078 people killed by the disease in total and confirmed infections at more than 60,000. But a drop in the rate of deaths and new infections between Saturday and Sunday night has indicated that the curve is finally starting to flatten out. 2 weeks after the entire country was placed into lockdown. Today, the trend continued, with the total number of confirmed cases rose to 63,927 from a previous 59,138, an increase of 8%. The lowest rise in percentage terms since the contagion came to light in mid-February. Authorities in Rome reported that 602 died today, a staggering figures but significantly lower than the 651 on Sunday, and 793 who died on Saturday. Health official Silvio Brucifero resisted being too optimistic, saying that the improvements registered Monday were due to actions taken at the beginning of the month, not in recent days. We need more consecutive results to confirm the trend, to be more certain that we are in a favorable situation, he said. He stressed that while he favorably viewed the situation, I don't feel like taking one side or the other to confirm that it is there or not. We can take note of what we see today. The country also confirmed 5,560 new cases of coronavirus between Saturday and Sunday, a significant drop on the 6,557 cases confirmed between Friday and Saturday. Until now, Italy had been following an exponential growth curve seen in most Western countries including the UK and US, with cases and deaths roughly doubling every 3 days. While the latest data may be a temporary blip, it offers the first evidence that lockdown measures are helping to flatten the curve. Flattening the curve of new infections eases pressure on medical services, allowing doctors to better treat patients and helping to lower the death rate. Lombardy, Italy's worst-hit region, reported a total of 320 new deaths from the virus on Monday. The countrywide death toll has not yet been released. The 2-week gap between the start of Italy's nationwide lockdown and the slowdown in deaths and infections is significant, because analysts have said this is how long it takes social isolation measures to show up in the data. While the effects of lockdown are felt immediately in real time, the delay between people being infected, developing symptoms, and then seeking treatment means the data lags behind the real-world effects. It is doubly significant because analysts have also warned that the UK, with 281 deaths, is exactly where Italy was a fortnight ago. Though the government has so far resisted calls to enact a nationwide lockdown and force people to stay at home. Without such measures, critics argue, the UK faces a more serious fate than Italy, where one person died from coronavirus every 2 minutes at the weekend. Italy's current lockdown measures mean that people cannot leave their homes except for work, medical reasons or emergencies. Some cities require people to carry a permit with them onto the streets explaining why they are there. Shops except for pharmacies and supermarkets have also been forced to close. That is in stark contrast to where Italy was 2 weeks ago. As politicians including Nicola Zingaretti, leader of the governing Democratic Party, traveling to Milan to insist that business should carry on as normal. Just a few days later, she announced she had contracted the virus. Giuseppe Pontalio, a social psychologist at Vita Salute San Raffaele University in Milan, told The Guardian, "At the beginning people were not really believing what was happening, so politicians like Zingaretti and others just wanted to reassure the population." He went to Milan to demonstrate some forms of social behavior were still safe and that the government was working towards a solution and so on, but he of course underestimated the risk. Dr. Emanuela Catenacci, who works on intensive care wards in the worst-hit Italian region of Bergamo, issued a stark warning to the UK. Speaking to Sky News, she said, "We know what happens. Don't think it is happening here and it can't happen everywhere else. Because it will. Germany's death rate from coronavirus is far lower than that of its hard-hit European neighbors, but scientists are not sure why. The latest official figures show 22,762 coronavirus cases in Germany and 86 deaths, a death rate of just 0.4%, or 1 in every 265 patients. That puts Germany's death rate well below that in Britain, 5.3%, Italy, 9.0%, France, 4.5%, Switzerland, 7.4%, or Spain, 5.4%, which along with Germany are the 6 worst affected countries in Europe. There is no obvious explanation for this because Germany has a relatively old population, a comparable health system to other countries, and has only imposed nationwide quarantine measures in the last few days. One possible factor is that Germany is testing more aggressively than some countries, aiming to find every case, meaning that its death rate could be a truer picture of the crisis. The known patients in Germany are also younger than those in Italy, possibly lowering the death rate of a virus which is known to be more dangerous to older people. Germany also has more intensive care beds than Italy, France or Britain, meaning that patients could be recovering more quickly. The government on Sunday warned that it will go further, slowing industrial production nationwide while Lombardy, the hardest-hit region, has banned outdoor exercise and set distance limits on dog walking. Franco Locatelli, president of Italy's Higher Health Council, said Sunday that with the new stringent measures announced this weekend, Italy had exhausted all the possible ways it could to limit personal and professional contact. Let's continue to keep social distance, Locatelli said. Let's adopt these measures, let's manage our behavior, and certainly we will get the results we are hoping for. For most people, the new coronavirus causes only mild or moderate symptoms, such as fever or coughing. For some, especially older adults and people with existing health problems, it can cause more severe illness, including pneumonia. More than 95,000 people have recovered, mostly in China, after a week of complaining that too many people were still out and about in Lombardy. Authorities in the hardest-hit region, with nearly half of Italy's cases and two-thirds of deaths, issued the clearest measures yet to close loopholes being leveraged to circumvent bans on movement. As of Sunday, the maximum radius for dog walking was set at 200 meters, and all outdoor sport that cannot be practiced at home was banned, not because sports posed a threat, but because people were abusing the freedom of movement. Authorities in Lombardy also raised fines for violators to €5,000, $5,345. The Lombardy moves came just ahead of new measures announced by Premier Giuseppe Conte to slow industrial production in Eurozone's third-largest economy and a major exporter to only sectors deemed crucial. The government on Sunday was still drawing up the list for the slowdown, set to take effect early in the week. Locatelli urged anyone whose job would be idled by the new measures to not travel to their hometowns or risk spreading contagion. He also called on the more than 23,700 Italians with the virus and who are isolated at home to steer clear of family members as outlined by the health ministry, to keep the virus in check. Italy first moved to prevent the virus from arriving in the country by signing an order January 31, shutting down flights to and from China. A day earlier, authorities confirmed that a pair of tourists from Wuhan had tested positive in Rome. Both have since recovered. But it wasn't until February 21 that the first case of locally transmitted COVID-19 was confirmed, in the town of Codogno, southeast of Milan. The town and 10 others, with a total population of 50,000, were immediately isolated. The government on Feb. 22 created the first red zones in the 11 Lombardy towns and the town of O. Eugenia, near Padova, with soldiers setting up cordons around the area and residents permitted to leave their homes only for essential activities like shopping. Industrial production was stopped with rare exception. The next day, February 23, the governors of Lombardy and neighboring Veneto, where Padua is located, shut down museums, cinemas and theaters. but stores remained open as did restaurants until 6 p.m. Bars. The closures emptied city centers but appeared to have less impact on inhibiting activity in neighborhoods, suburbs or small towns. Fitness routines moved from closed gyms to outdoor parks. The last 2 days of Carnival in Venice were cancelled, emptying the city of tourists. Schools and universities were closed in much of the north. By the end of that week, the 1-meter distance rule was set for shops and restaurants, but that was not universally observed. Early the next week, people over 75 years of age were advised to stay at home. Schools were closed until March 15 in all of Italy, later extended until April 3. Non-urgent court trials were suspended. With cases still multiplying exponentially, the government on March 8 signed measures extending containment zones to all of Lombardy and 14 provinces in the other northern regions, affecting a quarter of the population. Under the measures, people could leave their immediate areas only for work, healthcare or activities of strict necessity, like shopping. When Italian media reported that the closures were imminent, thousands of people jammed trains to get back to homes outside of the new red zones, a mass movement that virologists have said helped further spread the contagion. Just a day later, on March 9, the government extended the lockdown to the entire country. But enforcement was still a matter of interpretation. The mayor of Verona closed parks, seeing too much movement, while Florence's mayor seemed to condone an outside jog. Dog walking remained a valid motivation, but videos popped up on social media of Italians with fake dogs, shaggy stuffed animals on the end of stiff leashes. 2 days later, on March 11, all commercial activities except for those providing necessities were closed. From March 11 to 15, the Interior Ministry reported 665,480 people had been controlled, with 27,616 people cited. On Sunday, Rome Police Chief Franco Gabrielli said 80 people had been cited a day earlier, including for shopping 10 kilometers (6 miles) from home, traveling 15 kilometers (about 9 miles) to a doctor's appointment, and claiming medical reasons for being out for a walk but lacking a doctor's certification. Horrifying images show coronavirus patients lying on the floor of a packed Madrid hospital as city is overrun with cases. Terrifying footage from inside a Spanish hospital shows coughing coronavirus patients lying on the floor of a corridor as they wait to be seen by medical staff. The shocking clip shows some patients coughing deeply as a medic stands nearby, and some of those on the floor appear to be hooked up to oxygen tanks. The scenes were recorded at the Infanta Leonor Hospital and the Severo Ochoa de Leganes Hospital in the Spanish capital Madrid, according to El Mundo. The video, which was reported locally, was shared online to urge people to follow social distancing measures being enforced in countries across the world. Spain's death toll jumped to more than 2,000 today, an increase of 462 deaths, with 33,089 cases of the infection now recorded. Madrid has recorded 58% of the country's deaths, and the crisis has brought the healthcare system to the brink of collapse. The country is in danger of becoming the new epicenter of the outbreak in Europe, with Italy's latest figures offering some hope that the crisis there could start to ease. Spain's Deputy Prime Minister Carmen Calvo is among those awaiting urgent test results today after he was taken to hospital with a respiratory infection on Sunday.